Hey everyone. So I'm back. Today's the day I see my primary care to debate whether I get admitted to the hospital or not. At this point, I think most of my support system, I guess, would want me admitted. I agree with them. I can only, take care of myself so much anymore, and I'm 22 years old and I should be able to take care of myself. I should be independent. I should be doing, 22-year-old things. But instead, I've been relying like on my mom to do a ton of stuff for me. I had her make me a chocolate shake yesterday because I wasn't feeling the best. And she did. It was amazing. It was delicious. Um, But yeah, so I have an appointment later today, and I'll probably post another quick video because these are just gonna be. I'm gonna upload like two, but they'll be like short. Um, so I'm uploading one before I see my doctor, and then I'll update to see what the decision was. Um, yeah, so I was going through my results, just trying to get my eggs in a basket, because my recent blood results have gotten worse, and I noticed my renal ultrasound is now accessible for me to read. And so I went and read it, obviously. And my urologist neglected to inform me that I now have let's use their word, probable cyst on my right kidney. Um, just because I'm gonna say this calmly and, I'm just gonna say it. Just because you may not think a cyst is important to tell a patient, like if you think it's harmless, doesn't mean you don't say anything about it, because now that just like gets in my head. I have another cyst, I have one in my brain. I've had one burst in my ovary. It was a hemorrhagic cyst I had burst on my ovary. I was bleeding for like a week because of it. I what? Yeah, now I have a kidney cyst. So, along with Ehlers-Danlos patients, there's been a common aspect among us is that some of us develop cysts in our bodies, throughout our bodies and stuff. So, if you're a doctor and you know EDS can, your body will form cysts, and you see this person has another cyst, you don't think it's important to tell them that they are now developing cysts on their other internal organs. To me, that's just so backwards. It's so important, to communicate to the patient no matter what is going on, even if you're not worried about it. Be like, so we did find this. This doesn't worry me, but I thought, maybe I should tell you and let you know what's going on. Nope, nope, she didn't tell me. I had to find out myself. I was going through it, and let's see, right kidney measures 10.5 centimeters. Description: unremarkable in echogeneity. Big word. I don't know. Without evidence of shadowing, calculus, hydrophrenesis, and other big words. But basically, after that, it gives dimensions to something that is not part of my kidney. It says midpole. Midpole is 0.4 by 0.4 by 0.3 centimeters big. Uh, partially exo x5. I don't know, more big words, and then it says probable cyst at the end. No detectable intral interlesional vascularity. I don't know. Anyway, it says it's a probable cyst. There's nothing to determine otherwise from those big words I got, which is good news for me, but bad news because now I'm worried about my other organs because my insides do cause me pain sometimes. And it's not just GI related. Like, it'll be random. My organs will hurt me. If I move my ribs a certain way, everything just kind of pushes on each other, and it causes like super soreness, and it's definitely like on my insides. Um, but yeah, I'm also worried about my back now because I've been thinking like maybe I have potential tethered cord syndrome as well, just because I've had such uh, abnormal back pain for me. I'm usually my back's okay and pain free, but lately, right in between the center of my shoulder blades in my back, like in my spine, I've been getting like the shooting pain here and there. And that makes me think like maybe what if it's a cyst? What if there's a cyst in between my vertebrae and nobody detects it because doctor in urology doesn't think it's important to mention that I have a cyst on my kidney. But anyway, that's part of the reason why my doctors let me get so bad. They don't communicate with each other, they don't communicate with me, and they assume I'm healthy. Like, look at me, I look healthy, right? I'm not. And it really has been getting on my nerves. And with my health being so bad, I got off of Facebook recently too because I can't share a video without someone trying to defend an argument or something. And just I posted a video of like just saying how I think we need to treat people better because I'm not gonna get into it because this is a YouTube channel for health and stuff, but there was 40 plus comments on it, and I was like, I was only a couple of them because I stopped. I don't even bother with that. I say what I have to feel like I have to say, and then I'm like, you know what, you're not worth my time to argue with. But then, when you get three other people in an argument on my post, you get the notifications and it's like, stop arguing. I don't need to see this. So I got rid of my Facebook because my health just can't deal with the negativity anymore. I was actually getting heart palpitations reading the negative things on my posts and stuff. It makes my heart race. And sometimes if I get upsetting texts or if I'm conversing with someone, I'll get like palpitations. So I just didn't have time to deal with it anymore. I'm sick of it, quite frankly. So I got off of Facebook. I only have Instagram now. I plan to join back on Facebook once my health improves, but I have like Instagram, Twitter, my email. I gave my email out to people who were, wanting to keep in touch. Um, yeah. Excuse me. Yeah, and I slept so well, so I don't know why I'm yawning. I slept until 10, which is late for me. I usually wake up like between 8 and 9. Um, yeah, but I slept like a rock. I went to bed early too. I guess I needed it. I need my beauty sleep. Um, yeah, so I talked about my upcoming appointment, talked about my cyst and how I'm upset my doctor didn't tell me. I'm trying to think if there's anything else I need to discuss real quick before I end this video, but nothing's coming to mind. So if it comes to me, I'll update you guys on my next video. But if not, I'll see you around. Yeah, so I'll try to make another follow-up video to see if I'm admitted or not. But yeah, in the meantime, just hang tight and I'll see you around. Take care, guys.